Hi, I'm Peter Hill and welcome to the D Word here on UK Health Radio, the show where we talk dementia. Glad to have your company for another hour of dementia chat and music. Now, running a care home is a difficult task at the best of times, but over the past couple of months, it's presented a whole new set of challenges. My guest this week is Aliyyah-Begum Nasser, Operations Director at Askham Village Community in Cambridgeshire, and she's going to be telling me how they're coping with the COVID-19 pandemic.
So Askham is a group of care homes, specialist care homes. We're all on one site, five homes in Doddington in the Fenland area. One of the homes focuses on providing care for people with dementia. One looks after people who have palliative care needs. And the other three are for younger folks, mainly with neurological conditions, be that rehab needs, complex care needs, or long-term neurological conditions that we support people to live as comfortably with as we can.
So you've got a complicated life anyway, and then suddenly across the horizon comes COVID-19. So multiply that by 1,000, I should think.
Absolutely. It was not quite the year 2020 that we were expecting. We actually did a really good job this year for the first time of doing some real sort of ground up strategy work within the organisation. And we identified that our focus areas were around staff wellbeing, best practice, innovation and technology, and then reaching out and working with community organisations. And I have to say, we didn't expect 2020 to unfold the way it has, but those three things continue to be our top priority. You know, how can we look after our staff in the best way that we can? What is best practice out there that we can draw upon? And how can we work best with other people in the community, the GPs, the pharmacies, the local authorities, our family, relatives, so on. So, yeah, it's unfolded in an unusual and unexpected way, let's say.
I'm sure. I mean, obviously with you as well, you've got different sites with different things, so they all pose their different challenges. And I guess when you add COVID-19 poses its different challenges to everything you do as well.
Absolutely. It's really become, Pete, like a new normal. I think we've started to try and think about this as this is how we are now, rather than how we are is something different, and this is like a mini break or a mini patch where we have to do things in a different way. Because I think it's the only way we're going to get through it, really, because we don't know how long it's going to be for. So we have to find ways. So, for example, relatives not being able to visit, we've had to find ways to enable people to stay in touch through this period, irrespective of whether they can be physically present or not. Training is another one. We could have taken a break from training and said, okay, let's just stop because we can't get together and do all of that. But we could be doing this for the next 6, 9, 12 months, and we don't know. So we've had to find ways to provide induction training, to provide ongoing training and support for staff in this new way. And it's, credit to staff in amongst doing everything else they've been doing. They've taken it really well, and they have really embraced the new way that we're trying to provide training and support them with skills development and all of that as well.
Yeah, and I guess, you just alluded to it a little bit. Despite everything that's been thrown at you, life goes on. People still have to be fed. Things have to go on, some form of normality.
Absolutely. Initially, we thought, should we stop recruitment? Should we put a hold on it? But then, you can't, Pete, because we're in this position for a long, certainly to the medium term. We don't know when it will end or how it will end. And if you put things on hold, well, like you say, life has to go on.
I'm chatting to Aliyyah-Begum Nasser from Askham Village Community about measures they've put in place to cope with COVID-19. There's plenty of good guidance out there for care homes to follow, but of course when you're dealing with residents living with dementia, as Aliyyah admitted, some of it is very difficult to implement.
If I think about the government guidance to isolate anyone showing symptoms, for example, so anyone with a fever or a cough, when you're in a dementia care home, even though people might have their own rooms and have their own bathrooms, so, in theory you can isolate them, You can't, because some people like to move around. They like to wander around the home. They won't necessarily understand what it means when you say, isolate, or when you talk about virus. I mean, these things don't necessarily, they won't compute in the same way. And so you just can't isolate in that way in a dementia home. So the whole approach to risk management and infection control in our dementia unit, it's a completely different ballgame. It's a completely different ballgame. And we can't, government guidance is very generic and applies to the likes of you and I, but doesn't really take heed of the specific needs of certain groups, and dementia, people with suffering with dementia being one of them.
Do you think kind of when this comes to a close, that people will actually look at that subject and highlight it as, obviously an area that needed work on?
Absolutely. And I hope that they do. I do hope there is a lot of learning that comes out of this, because I think it's critical, and particularly because number of people with dementia is a growing population in our, in the UK. And it's only going to continue to grow. And, how do we, innovations around how do we do PPE in an environment where you're supporting people with dementia? I mean, PPE for people with dementia just needs to look completely different. You turn up to somebody with a mask, you're going to trigger some behavior that you really don't want to be triggering. So how can we protect staff and protect residents using some sort of equipment that does the job, but, doesn't inadvertently cause us other problems?
Yeah, it's a really good point. I think, it's a general point anyway in terms of the way staff look in terms of looking after people living with dementia. I mean, I guess, is this where your contacts with other people in other homes really come into their own as well?
Absolutely. So I'm part of the Cambridgeshire Care Providers Alliance, which is an alliance of care providers across the county. And it has really come into its own in terms of sharing best practice, how to tackle some of these things, how best to support staff when dealing with it, because there's not always a single answer to these things. It is case by case. And I think particularly, Pete, the challenge has been around, because we don't have as much relative engagement on site as we had, particularly for some of those folks who are really suffering, with dementia quite acutely, seeing that familiar face, seeing that relative really helped us and really helped the staff to help manage and, give those people a bit of solace. And I think, hearing how others are dealing with it, how others are coping with those challenges, is really helpful, partly to get some tips and tricks, but also to understand that we're not the only people that are struggling. Because I think that also is a good, good form of therapy in some ways.
Yeah, I think it's always nice to feel that there are other people in the same boat, as it were, going through the same kind of thing. I mean, what has been the reaction to the love, from the loved ones that unfortunately can't see their parents, their relatives, etc.?
Initially, I think we were really worried, Pete, that people wouldn't be very supportive and people would be a little bit anxious about the decisions that we'd made. But we were proved wrong on that front. Everybody has been incredibly supportive, amazingly understanding of the reasons why we've made these decisions. And actually, the outpouring of support we've had through social media or through email, using Skype, relatives are struggling, and bless them, they can't see their loved ones and you don't know when that may end. But everyone is really, really supportive, and I cannot fault them. I think we've had, and it gives the staff a lot of comfort to know that the relatives are supportive, because I think that would also help, that would make it much harder if we didn't have a supportive relative community. But yeah, I can't fault them, Pete. Can't fault them. They've all been amazing.
And as Aliyyah has witnessed from first hand, it certainly helped isolation for residents in lockdown become more bearable. Yeah,
I mean, it's amazing. I got sent a picture of one of my residents on Skype with their wife for their anniversary. And I mean, these people are elderly people, they're not Skype and tablets, and all of this is not their normal way of working, but people are embracing it and it's working, and the smile on his face, it was unrivaled. I mean, it was just lovely. So yeah, the more of that we can do, the better. We've had the technology side, we've had grandchildren write in letters, send us postcards. It's been brilliant. And I mean, we've been able to send photos to relatives of our residents sort of holding up placards saying stay safe, stay home, see you soon. But again, it's heartwarming to see how people have tried to make the most of what is a really, really difficult and horrible situation.
Yeah, absolutely. I mean, in terms of things like equipment and PPE, I mean, have you got everything you need?
I never want to answer that question because I feel like I'm going to jinx it. For the moment, I'm going to touch some wood. We're okay. Again, we've been really lucky because we've been able to work with some other care homes to source reasonable volumes from outside of the UK. And that's been really helpful. Without that, I think we would have been really up the creek. I think the government are trying really, really hard, and I can't fault anybody who's involved in this process. I can't imagine how hard it must be for them, but the supplies just aren't coming through from the processes that have been set up. So I think, it's not been easy, but we've managed thus far.
And I guess a little bit earlier you talked about training, and I guess there's kind of a big onus on training for, just it's another condition, isn't it? COVID-19.
Mm-hmm. Absolutely. And I mean, Skills for Care have brought out a lot of virtual training for people caring for people with dementia and people in care homes. And we are using a lot of that. We're drawing upon a lot of those resources, but we're also doing our own. So our training manager is now delivering all training by Zoom, which is great. And it's serving a purpose, and it's definitely filling a need. What can I say? Yeah, we're just trying to make the best of a bad time.
Sure, that guess what everybody is doing. I mean, in terms of your links with other healthcare professionals, I guess you're almost a bit of a triage, because presumably you'll be giving them more information than you normally would, because they're not going to visit.
Yeah, exactly. So we've been doing our GPs have been amazing. Doddington Medical Centre have been fantastic working with us. We've been doing GP, MDT sort of meetings by Zoom. They've been doing video calls with residents when they need to see them in person. We've been doing other reviews, commissioning reviews, all of that by Zoom, meeting, doing all of that. And yeah, I mean, it seems to be working. I mean, the processes are sort of initially, there's always technological challenges, but the processes do seem to be working, and we are getting the right levels of input that we would expect from these professionals, given the pressures that they're under. Again, medications for people suffering with dementia and elderly folks, the supply of medications and making sure that doesn't stop is critical as well. And again, working with the pharmacies, we're sort of, I think we've been in this process now for long enough. We've been in this for 5-6 weeks almost. And so it feels like we've gotten into a rhythm where things can happen, in a sustainable and comfortable way so far.
My guest this week is Aliyyah Nasser from Askham Village Community, and one of the most difficult decisions for care homes at this time is whether to accept new residents.
So every care home is making their own decision. For us at Askham, yes, we are still accepting residents. We've had a bit of a challenge around testing. Our policy for us is that we wouldn't want to admit anybody that hasn't been tested, so that we know where we are with this. And you'll have seen in the news, and it's been all over the papers really, about this testing debacle. But since last week, I think from Thursday, Friday, we've seen a huge change in the hospital mindset. And now the willingness to test and the kind of the ability to test, I think, has finally cascaded through and is happening. So yeah, our approach now is that we are happy to take new people into the home. I think it is the right thing for these people to be moving off into care homes and not necessarily staying in hospitals too long, especially those who have an element of, or some form of dementia. But our prerequisite is that they have to be tested, because I have 100 other residents on site that I can't compromise.
Yeah, sure. I mean, that's totally understandable. I mean, because obviously one of the concerns is there will be people living with dementia in the community who are, I've gone through this with personal experience, who are at that stage where you're thinking, well, actually, we should be looking at permanent care now.
Yeah. Absolutely. And I mean, I think we've had a couple of families reach out to us in that situation. It is a little bit harder because obviously you can't get the community tests in the same way as you can from hospitals. But I think where we can, we would like to support these families because, like we said earlier, life goes on. And if somebody's suffering in the community and they've sort of crossed that line and now can't cope at home anymore, our job as a care provider is to help support those people in the next stage of their needs. And so, I wouldn't ever want to say a blanket no, because we're a care home. We care. I mean, it's in the name. We have to be able to support these people, and that's what we do. But we just have to be able to do it safely.
Sure. I mean, you're 5-6 weeks in, as you say. I mean, are you surprised by some of the things you've learned over those 5-6 weeks?
I'm surprised. I'm not surprised. I'm in awe of the staff. Absolutely in awe of the resilience and the incredible support that they're all providing to each other. Actually, it's not coming from me, it's coming from staff members to staff members. That's one thing I would highlight. The other piece for me that I've been really surprised about is actually the responsiveness of the local authorities and the bodies that we report into, the CQC and others. I think they are struggling because they're getting a lot of directives from central government, and the kind of walking the walk isn't quite following the talking the talk as quickly as it should. But to their credit, the people that I'm speaking to on this stuff are really trying their hardest. And I think, again, I would say I've been really surprised by how responsive everyone has been. Not necessarily being able to fix the problems or solve the issues, but at least being able to respond and say, let's try this, let's work together, let's do this, let's do that. Which, best we can ask for, really.
I'm chatting to Aliyyah Nasser from Askham Village Community about the challenges of running a care home in a global pandemic. Living through unprecedented times does, though, give the opportunity for learning, and the hope is that knowledge gained now will be put to good use in the future.
I hope so. And I mean, I don't even know what this is over really means. I don't know what that could be. I worry. Well, I don't worry, but I think about what that looks like in a care home environment. But yeah, you're right. I think there's a lot of learnings, and I'm hoping that we do take heed of those going forward.
And I guess it's, as you said, we're all doing it. We're adjusting to the new norm, isn't it? I think we have certain problems. I mean, even I sit here and wonder what day of the week it is. But you have to readjust. And 5-6 weeks into doing that, I think it's really heartening for the listeners to hear what you've been saying about how you've managed to do that in such a comparatively short space of time.
Well, we are trying. And every day, I don't know what tomorrow brings. We don't know at the moment, we've been blessed with the way things are at Askham. And I do look to the sky often and say a huge thank you. But we don't know what tomorrow brings. And, and the same is true for everyone, I'm sure, for all of your listeners. And we just have to acknowledge and appreciate the positives when they're there, because, they might not always be there. But we have to prepare and be ready and do the best that we can, in the best way that we know how. And that's all we can really ask. And if I come back to my staff, Pete, that's all they're doing. And that's all we can really ask of them at the moment. So, yeah, I just hope, the message to your listeners, I guess, I hope everybody is staying safe and staying well. And interestingly, today, one of my team was saying we need to change our mantra from staying safe to staying sane. Because I think in this moment, in this time of isolation, our mental health is actually critical. And there's been a huge focus on physical health and making sure that we manage that. But the knock-on impact on mental health, particularly for people who already had mental health conditions, could be significant, especially if this continues for a much longer period. So we're sort of also trying to shift our mantra into that as well, and make sure that we do keep a lookout for our staff, but also our residents' mental health in amongst it all.
Yeah, I think that's a great message, because we do concentrate a lot on physical health, but mental health always seems to come second. And I guess in this it is slightly coming second, but it's great that everybody is now taking note of that, because if you take people out of their norm, then you're going to get a reaction, and that goes for someone living with dementia. That goes for anybody, really, doesn't it?
Absolutely. I couldn't have said it better. It's spot on.
Well, and yeah, I know you're very busy, so thank you so much. It's been excellent. It's given us a real insight into what's going on in the GARE community. We can only keep our fingers crossed that things do come to a close, hopefully sooner than we expect. But we've got to take the positives out of the new norm, I think, is the message that's come across.
Absolutely. I agree, Pete. And thank you so much for talking to me. I appreciate it.